Sorry. Um, Good afternoon, everyone. Thank you for being on the call this afternoon. I have with me Dr. Raynard Washington from the Health Department, as well as Dr. Rick Tankersley from UNC Charlotte. And we are here to talk about the recognized case of the Omicron variant in an individual in Mecklenburg County. That individual is a student at the university, and the actual recognition of the variant in that particular case was identified through the sequencing program at UNC Charlotte. So I'm going to turn it over for a minute to Dr. Tankersley to talk a little bit about where they are with this situation, and then we'll open it up for questions.
Thank you, Gibby, and good afternoon, everyone. I just maybe give you a brief summary of what we know about this particular case. So this is one of our students who lives on campus who traveled over the Thanksgiving break and contracted COVID during that time. When they returned to campus, they were symptomatic and were tested through our COVID testing lab here on campus. Based upon the results of that test, we also to do with all our positive samples on campus, and also as part of our collaboration and partnership with the county, is we sequenced that positive case and received the results this morning that in fact it did identify as the Omicron variant. So as I said, this particular student was symptomatic during that time, was isolated following their positive PCR test, and has since recovered from COVID and is no longer in isolation. So they also, any close contacts that we identified were contacted through our contact tracing team and tested, and none of those close contacts turned out to be positive. So there's no indication based upon the information we have that has been any transmission from this particular student to anyone else on campus or anyone else in the community.
Thank you. The one thing that I want to emphasize here is that number one, the fact that we do have some sequencing that's happening in the community is beneficial to us and helps us understand the different variants that are impacting our community. And Delta obviously continues to be the main issue for us here in Mecklenburg County. But the other thing that I want to point out is the systems that we have in place in Mecklenburg County, the work that's been done, the collaborations that happen on a daily basis are really play out nicely in this situation where the student was recognized quickly with symptoms, was tested, was isolated, contacts were found, and so it's happened exactly the way we need it to happen to prevent further spread in our community. So I want to thank UNC Charlotte for their work on this, but also for the partnership and working with us through these situations. I'm going to ask Dr. Washington if there's anything he'd like to add to this before we open it up to questions.
Nope, I would just say I think this is just another reminder for our community why it's important for folks to continue to do those things we've been encouraging all along. Of course, get vaccinated if you're eligible to get a booster, and go ahead and get that done as quickly as possible. And of course, when you're indoors in public settings, please wear a mask.
Thank you. So we'll open it up to questions now.
First question today is Brett Jensen, WBT Radio.
Hey guys, just curious, Dr. Washington, Gibby, Dr. Tankersley, I'm just curious, as you guys knew this was eventually going to happen here, in terms of the Omicron variant, what do you guys know about it? I saw a report the other day ago that like 15% of all the children in England are now developing rashes that contract the Omicron, but there might have also been reports that it's not quite as serious as Delta, the symptoms are less. So what do you guys specifically know about Omicron?
Probably not much more than you're reading, Brett, because it's evolving as you know. It's still a fairly new variant out there, and we're seeing how it's evolving in the different communities that is seeing large numbers of this variant. So we're watching it as closely as you are. The main the main point here, I think, is again for people to do what they need to do to protect themselves, and that hasn't changed. So we know we're going to see it in our community. We know now that it's here. I'd be surprised if it hadn't been here before, but we are watching closely what people are experiencing in other communities and other countries. And as we know more about it, we'll definitely make the community aware of those things.
Next question, Chloe Leschner, WCNC.
Thanks so much. Just wondering if there's any more you can share about this student, kind of what their symptoms were. Was it a severe case? Were they vaccinated? And then do you know where they traveled to? Was it out of North Carolina? Thank you.
So I can give you a bit more information. They were traveling outside the state. They were fully vaccinated as well. We do have that information. Their symptoms appear to be fairly mild based upon the report to us, and we're in the isolation facilities that we have here on campus recovering from those symptoms, and so there was no hospitalization associated with this particular case.
Next question, Derek Dellinger, Fox 46.
Thank you for taking my question. It's actually two quick questions here. As far as we know, is this the first case, just to be official here, is this the first case that we are aware of in North Carolina? And also, are you surprised that it's actually here in Mecklenburg County?
So in our conversations earlier with the state today, this is the first confirmed case in North Carolina. Obviously, the first confirmed case in Mecklenburg County. With the travel that we have in and out of our community, I'm not the least bit surprised that we don't have the first case that's documented, but I'd also be surprised if there's not other cases in our state that just have not been discovered at this point.
Next question, Will Wright, Charlotte Observer.
Hi, thank you all. I just wanted to get a bit more on the timeline about when was the student actually tested, and if they've since recovered and they're now able to not be in isolation. It seems like it would have taken, like 10 days to get this result back. Can you walk me through that and just how you do the sequencing for Omicron?
Sure, I can give you a bit more detail on the timeline. Testing was done when they returned to campus right after Thanksgiving, and through as I mentioned earlier, through our testing facility on campus. Based upon those results, all positive tests are then handed off to our sequencing team that combines those positive tests with others that we're collecting through a partnership with the county and StarMed to be able to monitor and survey the presence of different variants within the community. It takes much longer to process the sequencing data samples, mainly because there's not just the analysis has to be done through our sequencing unit, but also the actual once you've sequenced the variants of the virus, you have to then interpret those results. So it takes about 5 to 7 days for us to complete that process, and so I know it seems like it's been some time since that positive case was identified, but it takes a period of time for us to be able to process those samples effectively.
Next question, Diego Barahona.
Thank you. Escuela Noticia. We have right now around 20 states with Omicron cases confirmed in the U.S., and we are approaching to Christmas. So what would be your message for people that are planning to travel at this time?
Reynard, I'll let you handle that one.
Sure, yeah. So as the holidays are coming, I think I'll go back to my comments earlier. First and foremost, the first thing we all need to do is get vaccinated if you have yet to do that. If you're eligible to receive a booster, go ahead and get your booster and plenty of time ahead of the holidays. Encourage folks to continue to do those basic prevention measures that keep the spread of COVID and other viruses down. That includes the hand washing, if you're sick, please stay at home. And of course, if you are traveling to another state, another city, another town, You don't want to do so if you have any of those symptoms. You may consider getting tested before you travel, and certainly watching for symptoms if you're around other individuals. And when you get back home, also as well, continue to watch for any symptoms if you've been in indoor settings or around other folks or large crowds of people that you don't otherwise live with. But I think the most important point, I'll go back to where I started, is if you have yet to get vaccinated, please do get vaccinated. That is what we need folks to do to keep folks out of the hospital, keep people alive, and keep folks from having or experiencing severe illness.
And the only thing I'll add to that is that that's the case whether you're trying to avoid Delta or Omicron or any other variant that's out there right now.
Next question is from Chris at WRAL.
Hello, can you hear me? Is my mic working?
Yes.
Okay, just double checking there. Sorry, two people already asked questions that I had. I guess I'll just ask. I know you said you expect this to kind of be the case with as many people traveling through there. I mean, going forward, what should people know about Omicron? I mean, if we keep seeing variants of different variants of COVID that pop up here and there, I mean, you know, I mean, what do they do at this point? Some people are, I guess, are kind of waiting to see like, oh, is the country going to shut down again, or do we just kind of wait to see what happens because it's still relatively unknown?
That's a great question. And a lot of it depends on what we're seeing in our communities, in our state and across the country as well. The reality is we're moving into the winter months. It's colder and our viruses like colder weather. And we're also looking at another set of holidays that we're moving into as well. We're hoping that we will not see any big spikes in numbers, that we'll be able to sort of maintain. If we see increases, that they're small, but we anticipate potentially seeing some increases over this period of time. And that just reemphasizes the need, as Dr. Washington mentioned, for people to get vaccinated, to get boosted, and to wear their masks indoors and to protect themselves and to protect others. You know, this virus is not going away. It is not going away. That's probably the one thing that we can pretty much say for certain. What it does, how it mutates, and how we manage it are the variables that we have to deal with. And so the one thing that we have control over is how we deal with it. And that goes back again to getting vaccinated, wearing your mask, and avoiding large crowds. So those are the things that we can do to keep this under control. And that's what we're asking our community to do.